brain diseases, from the expressly psychological, like bipolar disorder, to those impacting movement, like Parkinson's, and memory, like Alzheimer's, are increasingly tied to inflammation. And inflammation is increasingly tied to toxicity in our environment. At best, leading drugs for Alzheimer's merely hope to slow disease progression. But my guest today, Dr. Russell Blaylock, who practiced neurosurgery for 25 years, says powerful natural steps can be taken to diffuse inflammation, remove toxins, and cut Alzheimer's risk. Now he'll present a nutrient regimen for healthy brain aging and for countering the chemical changes linked to Alzheimer's disease. In what forms and in what amounts do curcumin and vitamin E best counter brain inflammation? How do we maximize the detoxifying effect of the catechin found in green tea? And which fish best deliver the DHA essential for our brain cells, synapses, and brain function? Welcome to Vital Signs, where we learn how to get healthy from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendon Fallon. Dr. Blaylock, immense expertise to talk on this subject to help us identify these kinds of nutrients, specifically plant extracts that can help protect against Alzheimer's disease. And to start with, I'd like to draw on your experience as a neurosurgeon. I'm just interested to know how these things, these plant extracts, different nutrients, factored into your practice as a neurosurgeon.
I was a little different than my colleagues. I was interested in brain metabolism, and I studied brain metabolism. I was a biochemistry major, and I did postgraduate biochemistry courses. And I actually became a certified nutritional clinician. I was interested in immunological functions and how they affect the brain. So all this connects together for mainly brain disorders of neurodegeneration. And what we've discovered is they're all inflammatory. In fact, most diseases that affect humankind are inflammatory. And most of them are chronically inflamed, and it's a subclinical. So they're not aware they're inflamed, and as you get older, you become more inflamed. So I became interested in that. The brain has its own immune system, mainly led by microglia, which are the immune cell of the brain, and is connected to the immune system in the body. So anytime the body is disturbed in any way, it activates the microglia in the brain, and it's very closely connected to the biochemistry. So that was what I incorporated in my practice, and it had to do with recovery patients from neurosurgical procedures, and they tend to recover faster, the wounds heal better. It had a profound effect.
Could you give an example how that might have played out on a day-to-day basis, incorporating that kind of treatment?
Well, what I found is most patients have a typical Western diet. They're eating too many omega-6 fats, which are inflammatory. They're eating a lot of processed foods, which have chemicals in it. Glutamate's one of them, which produces brain destruction and brain inflammation, and as well as inflammation of other organs. So as I was incorporated, I found out these patients were a lot better. And the nurses used to say, Dr. Blaylock's patients do a lot better than everybody else's. And it was because I give them these things. And I protect them. I protect their nervous system. And I was interested in brain trauma. And I found out that it had a tremendous amount to do with brain trauma in terms of healing and recovery, particularly the magnesium. One of the researchers found that in mild trauma to moderate trauma, patients given magnesium infusion healed a lot better, did a lot better than everybody else. So I asked him, I said, well, are you going to do any more research? And he said, well, I'm not going to, because the pharmaceutical companies were not interested. They couldn't make a profit off of it. So it sort of went by the wayside for a while, and other researchers have picked it up and found the same thing.
When you mention magnesium, the first thing I think about is the cramps that I often get in the morning, these kind of the debilitating cramps that cripples my calf. My wife tells me I need to take magnesium. I imagine if magnesium can help in that situation, it's having some effect on the central nervous system. Is there some connection between that and what it can do in the the situation of someone having brain trauma?
Well, what we found is even with minor trauma to the brain, the magnesium level in the brain and the spinal system falls tremendously. And it'll stay low for a good while until the diet gradually replaces it. So even minor trauma can produce a very low magnesium. And studies of the diet have shown that most Americans are deficient in magnesium. Magnesium is one of the things that produces these cramping in the various muscles, particularly the calf muscles, but also potassium. And a lot of patients are potassium deficient. They'll wake up with cramps in the calf muscles, sometimes the thigh muscles, but it's one of the two, and sometimes both, a potassium deficiency and a magnesium deficiency.
The reason that the magnesium is low in the case of brain trauma is it that the brain is drawing on its magnesium reserve to try and deal with that injury? Is that why it's so low in those situations?
It may be, but we don't really know. We just know that once the brain is injured, the magnesium level falls tremendously low. And that replacing magnesium has a lot to do with protecting the brain, reducing the inflammation, and speeding up recovery so that the trauma is not as severe, doesn't have as severe a response.
So magnesium has a strong anti-inflammatory effect.
Yes, if your magnesium falls, your inflammation goes up. One of the measures of inflammation in the body is C-reactive protein. And we know that if the magnesium falls, the C-reactive protein goes up. So there's a general inflammation. And as I said, as you get older, your general inflammation goes up. And it may be partially because you're losing magnesium, not replacing it.
I see. And Dr. Blaylock, I'd like to talk to you about, it's good that we just covered magnesium a little bit there. I'd like to talk to you about a range of these different nutrients that can be used in preserving brain health. I'd like to take it back a little bit first, though, and to understand how the kind of inflammation that we talked about, how this could lead to someone developing Alzheimer's disease.
Well, it's most likely due to activation of the microglia in the brain, which is the primary immune cell in the brain. Like I said, even minor trauma in the rest of your body will activate the microglia. And over a lifetime, you begin to accumulate toxins like aluminum, exposure to pesticides, herbicides, fluoride. All of them will activate microglia. And that accumulates in the brain, particularly things like aluminum and fluoride. And it'll produce brain inflammation. And eventually, because of the release of the chemicals from the microglia, particularly glutamate, they'll get degeneration of the brain cells. And it'll present itself as Alzheimer's disease or Parkinson's disease. If you can quiet the microglia, then you don't get these diseases. And we've tried it in experimental animals which have genetically prone to develop Alzheimer's, are genetically prone to develop or use chemicals to produce Parkinson's disease. And if you give these substances, it can prevent it, get much less toxic to the nervous system. And that's the beauty of these things.
Okay. So the different nutrients that we'll talk about today, the main way that they're acting to preserve the brain health is by downgrading this microglial response that leads to toxicity.
Yeah, usually the microglia in the brain are in the what we call a ramified or resting state. And they're not really resting. What they're doing is they're secreting chemicals that stimulate the growth of the brain, the repair of the brain. It's only when they're activated immunologically that they start producing destruction. And so the idea is to switch them back to the reparative mode, to the nurturing mode. And there's several natural substances that can do that quite well, like curcumin and quercetin, and some of the T catechins, which we call EGCG, is the most powerful. Omega-3 fatty acids reduce inflammation. Magnesium reduces inflammation. They all quieten these microglia cells in the brain, which are the primary cells that's producing Alzheimer's and autism and all these other things that we see as neurodegenerative diseases.
I think you're so well placed to talk about this because you were working with people, with patients who had the most severe injuries to their brain, and you were directly seeing the effects of these things. So you come at it from such a first-hand standpoint that's so valuable.
There are over 4,000 flavonoids found in plants, and we're finding new ones all the time, and they're just amazing. They do unbelievable things, changing the pathology of all these diseases and returning it back to normal without all these serious complications we're seeing with drugs. They don't cost near as much. The unfortunate thing is most physicians don't know anything about them. They've never heard of them. They don't know about inflammation, the biochemistry of inflammation. And so if you ask your doctor about these things, they just sort of shake their head. They've never heard of it. They don't know about it. They don't know that curcumin is a very powerful anti-cancer agent. And I used to treat some people that had chemotherapy, demanding, they wanted to take chemotherapy, and it has a lot of side effects. And I said, well, take curcumin with it. It enhances the anti-cancer effect, and it stops the side effects. And so they found that, well, they weren't getting the side effects of the chemo. It preserved their hearing, their vision, their mentation. All these things were protected by taking curcumin with the chemotherapy. And so people need to, but most physicians don't know anything about it. They've never heard of it.
Excellent. I'd like to really get into how much of these different nutrients people should take, and and what they can do to really optimize the effect that they get from them. I'd like to get into that a bit later with you, Dr. Blaylock. First, it'd be good to talk about these things individually a little bit. We just recently produced a video about the benefits of elderberries, and what came through from that was the quercetin in the elderberry was a really powerful agent, powerful anti-inflammatory, powerful antiviral, antioxidant. So in the case of protecting the brain, I guess it would be the anti-inflammatory effect of quercetin that would be coming into play here as well. Is that right?
Well, there's really three things that you want to reduce in the brain, and one is free radical generation, which is connected to the inflammation, and excitotoxicity, which is due to the glutamate accumulation. And that really has to do with microglial activation. So those three things that you reduce, and you reduce it with quercetin and curcumin and luteolin and a number of these substances, will actually reduce the activity at microglia, so it's not secreting these harmful elements, and you don't get these neurodegenerative diseases. There's many things in our environment that activate those microglia, and most people are not aware of it. Just things that they do naturally, like their diet, this geoengineering where they're dropping nanoaluminum from the atmosphere, and it goes into the nose, it goes directly into the brain, and it goes to the part of the brain that is most affected in Alzheimer's disease. I warned of that. I said, if you do that, they're going to have increased Parkinson's and Alzheimer's, and both have increased significantly since they've been doing this on a large scale. So these simple things like adding fluoride to water. Well, we know fluoride activates the microglia and can produce these same inflammatory, free radical, and excitotoxic damages to the brain and the nervous system. And that's the sort of thing that these natural substances help reverse, help block. Most of the things that listed in this article that I wrote about how to counteract it have to do, they're anti-inflammatory, they're free radical killers, and they reverse microglia back to that reparative mode. So it's healing the brain and not destroying the brain.
As I mentioned, we covered elderberry recently. What would you recommend as a good source of quercetin? Do you recommend taking it getting it from food or taking it as a supplement?
Well, it's not likely you're going to get it in food. For instance, the Indians in India, they use a lot of curcumin in their food. They have a 4.4-fold lower incidence of Alzheimer's than people who eat the Western diet. And they have a drastically lower cancer of the colon. So it's very powerful at that. But the problem with curcumin is very poorly absorbed. And so there's ways to increase it. For instance, we use a nanocurcumin, which is nano size, is a very small size. And the curcumin level in the blood gets very high. And we know that once it's in the blood, it enters the brain very easily, and it's very non-toxic. They've used it in very high doses without any toxicity. And they check all the organs, blood, the liver, function of everything. And it's very safe to take long terms and high doses. And so this nanocurcumin, you get better distribution in the body, better distribution in the brain, better absorption. And they have a nanocurcumin, a nano quercetin, a nano EGCG. So a lot of these things have been difficult to absorb. Now we have a way to make you absorb them very well. So if you eat it with your diet, it does improve somewhat, but it's even better if you can absorb it better. Because once it's in the blood, then it goes in the brain very easily.
I see. And so the nano version of these things, it's just exponentially reduced the size of the particles? Is that how it's able to be better absorbed?
Yeah, it reduces the size of the particle tremendously, and makes, by being reduced in size, it becomes more reactive. That is, it works better. And it's distributed all over the body, and it enters the cell easier. So for instance, like curcumin lowers aluminum level in the brain, and it lowers iron level in the brain, and prevents iron from harming the brain. And we see many of these diseases are due to aluminum accumulation in the brain as well as iron accumulation in the brain. So it's helping that way. We also know that iron accumulation increases cancer risk. So by reducing the iron and making it less toxic, it reduces cancer as well.
I was reading in your paper that curcumin and also green tea are chelators of iron and copper. So meaning that, if I understand correctly, they bind to the iron and the copper particles. So is it the same, they're doing the same thing with the aluminium? They're able to bind to the aluminium particles to get them out of the body? Is that how it works?
Yes, and generally it doesn't prevent your absorption. It removes them from the body, and it makes them, even the ones that aren't removed, renders them less toxic, so they're not as toxic as they would be. But it's very efficient. There's not many things that remove aluminum, and that's the problem. These injections that they use aluminum, and you absorb 100% of it. If you eat aluminum, you only absorb about 30% of it. But the two combined, you're getting a very high aluminum level in the brain. Well, diseases like ALS, we know its number one link is to aluminum accumulation. And there's good evidence that Parkinson's disease and Alzheimer's is also connected to aluminum absorption in the brain and in the nucleus of the brain, causing Parkinson's.
We've spoken a little bit about the aluminum adjuvant in vaccines before, so that we understand that, and I'll put the link there so viewers can check out that video. We know that this is one class of injections that pose this risk. Are there other injections that also carry this risk of aluminum toxicity?
Well, almost all the childhood vaccines have aluminum in them. The flu vaccine has aluminum in it. Usually the live virus vaccine, they don't add aluminum. But then the fact that the live virus enters the brain, produces constant inflammation, and it can go on for decades, a lifetime. For instance, the MMR vaccine, the measles vaccine, inflames the gut. And we know that the intestines and the colon is connected to the brain by the vagus nerve as well as the blood, and produces the same effect, even possibly worse. So I think all of these things are causing chronic inflammation of the brain and leading to many of these diseases.
On the food side, which foods should people avoid that pose an aluminum toxicity risk?
Well, it's usually added, for instance, like biscuits and pancakes. They use a baking powder that has aluminum in it. They now make an aluminum-free baking powder, but they don't use them. So almost all biscuits have aluminum in it. Almost all pancakes have aluminum in it. People wrapping their food in aluminum foil and cooking in aluminum foil that aluminum is leached into the food. That's the major source of it.
Wow, that's very interesting to know. Is there any way to detect, if you're looking at the ingredients, if you're buying cookies or pancakes, is there any way to tell from the ingredient list what baking powder might contain aluminum?
Well, I don't know of any manufacturer that uses aluminum-free baking powder. So almost all of them are using aluminum-containing baking powder. And food is probably the second most common source of aluminum. Vaccines are number one. But people eat them for a lifetime. So if you're absorbing 30% of aluminum for a lifetime, you're accumulating a lot of aluminum in the brain and the other organs. And it's neurotoxic. It damages brain cells.
You've talked a little bit about green tea, Dr. Blaylock. The catechins in green tea, they have this chelating effect for copper, iron, aluminum as well.
Well, they do, but the major effect is one of the catechins called EGCG, which stands for epigallocatechin gallate. And it's been shown to quieten the microglia in the brain. It reduces the iron and the copper content in the brain, and it prevents amyloid accumulation in the brain. It does a tremendous number of things to protect the brain. But they found that actually the EGCG alone has the greatest effect. And there's a nano EGCG as well, made by One Planet Nutrition, and they make a nano EGCG, and it enters the brain very easily and protects it, as well as protecting the other organs. And generally, EGCG is safe, but occasionally a person will have liver problems with it. They stop it and it returns to normal. But they'll know that immediately. It's very rare.
It's very rare to have liver problems with it.
Right, and usually it's completely reversible once they stop it.
I see. How would someone know if they're having some kind of reaction like that if they try taking it?
Well, either the blood test will go up or else they'll have yellowing of the skin, which we call jaundice. And if they stop it, the jaundice goes away and the blood test return to normal. So there's about 3 catechins in tea. And it's the most powerful to protect your body, particularly your brain. So if you can tolerate it without any problem, which are the vast majority of people, it'll protect the brain against accumulation of amyloid and hyperphosphorylated tau and things that are changed in Alzheimer's. It protects against Parkinson's disease, and it protects the other organs as well.
Is there a specific type of green tea that is more abundant in this, or is it just green tea generally that people should be drinking?
Well, white tea actually has a higher catechin content than green tea. A lot of people don't like green tea, but white tea has a much higher content. And if I was going to drink it, you drink several glasses or cups of tea with white tea. They found that the incidence of Alzheimer's and some of these other diseases is significantly lower. But I generally take the nano EGCG to get a higher concentration.
I understand that white tea is quite popular in Japan, if I'm not mistaken. Is there generally seen a lower incidence of these kinds of neurological diseases in Japan or countries where they are drinking more green tea or white tea?
Oh yeah, certainly. Their incidence of heart attacks and strokes and Alzheimer's and Parkinson's is significantly lower than the United States. And the Chinese do the same. They drink white tea, and their incidence of disease is much lower. It can make a big difference.
Fascinating. That's a really striking difference across these continents. One thing that stood out to me in your paper was the part about resveratrol, which I understand is something that is found in wine. Could you say a little bit about that?
Yeah, resveratrol is found in the skins of grapes and blueberries and things like that. But generally, resveratrol is not very well absorbed. There's a form called pterostilbene, which when eaten is well absorbed, and in your blood it's converted to resveratrol. And so the highest content is with pterostilbene. Well, one of the highest contents is in blueberries. And researchers have noticed for quite a while that Blueberries are very healthy, very brain protective, and reduce aging. It's one of the few foods that will reduce aging of the brain. Some will retard aging of the brain, but not reverse it. And blueberries and strawberries and spinach has been shown to reverse it.
What is having that effect? What is it in these berries that's mainly producing this kind of result?
Well, in the blueberries, which is the number one, is pterogosilbean, which is converted to the resveratrol. And the others is quercetin. Quercetin is the most common polyphenol in all foods. And so you see it in teas, you see it in onions and garlic and things like that. You'll see it in a lot of different foods. You'll see quercetin. But like I said, it's poorly absorbed, most part. And we have ways to increase the absorption, mainly by nanosizing it.
Could people expect to get a certain amount of resveratrol through drinking wine?
Yes, and they found that people who are moderate wine drinkers have a significantly lower Alzheimer's rate. And when they looked at what was called the French paradox, the French were eating pastries and other things that we said were bad, but they had a very low heart attack rate. And they call it the French paradox. Well, they drink a lot of wine, and they usually have wines with their meal. And the chemicals in it, like resveratrol and anthocyanidins, prevent a lot of these changes that we associate with the Western diet.
But this isn't drinking to excess, though. This is having like,
no, it's a moderate amount.
This is a moderate alcohol consumption.
Yeah, alcohol itself is neurotoxic, but the resveratrol and the anthocyanidins in the grape juice or in the wine is very powerful at protecting the brain and reducing damage to the brain in case of strokes and damage from trauma. So it can counteract a great deal of it, but you don't want it in excess, because if you're drinking too much of the alcohol, then it's going to overwhelm it.
You spoke about the omega-3 fats earlier on. What do you recommend as the best source for those?
Well, omega-3 fats is divided into two components. One is DHA and the other is EPA. And the EPA will slightly thin the blood and it will reduce inflammation. The DHA is by far more present in the body than is EPA. There's hardly any EPA. Most membranes in cells are made with DHA, and that includes brain cells, synapses. So the DHA component is much more healthy. When we look at the research on feeding DHA to pregnant women and to newborn babies, they have far better eyesight and brain function than babies that are restricted from DHA. And usually, interestingly, we find that if a woman has multiple children, the last child gets the lowest level of DHA that's been used up on the other children. So it's important, and we see a lot of milks and things for babies that have DHA added to it, because this research has been repeated numerous times, and we know it's true. And DHA reduces inflammation in the brain and in the body, so it has another effect as well. And we know that DHA is lower in people who have Alzheimer's disease than those who don't. And we found that there's a significant lowering of people who eat fish once a week versus people who rarely eat it. And we find that people that supplement with DHA in the highest intake had the lowest incidence of Alzheimer's disease. So it makes a big difference.
I saw that in your paper, Dr. Blaylock, that people eating fish once a week had a 60% reduced risk of developing Alzheimer's disease.
That's right.
What kind of fish should they be eating? If we're looking at it from a dietary standpoint, how should people be getting this?
Well, actually, DHA is only in the plankton and the smaller fish. It has the highest level. What happens is the bigger fish eat the smaller fish, and that's where they get the DHA. So generally, if you eat sardines or anchovies or something like that, you get the highest DHA content. But you can
Right.
also get DHA in a supplement. But like I tell people, all of these oils like DHA and EPA, you need to keep in the refrigerator. And if you keep it cool, it lasts a lot longer. And people complain of burping up fishy taste. Well, you can prevent that by keeping it cool. And so if you eat a cool capsule that has a DHA in it, that usually doesn't happen.
I understand, and I'd like to go into the dosages, the amounts of these things that people should be taking with you in a moment, Dr. Blaylock. Is there anything else that we, in terms of these plant extracts, plant products, that we haven't covered so far you'd like to mention in terms of improving and preserving brain function?
Well, we're beginning to see a transition in brain diseases. It used to be that the microvessel diseases of the brain were less common than degeneration. Now we're seeing a lot more microvessel involvement of the brain, the smaller vessels.
Microvessel involvement.
Right. And they never knew what to do about it. And now we know that luteolin actually prevents the inflammation in the vein and in the artery. And there's a chemical that attracts immune cells to that artery. We call them macrophages, the main ones that attract. So that there's inflammation in the wall of the vessel, it attracts the macrophage, it goes to the vessel, and eventually through some very complex biochemistry produces a plaque, and that starts to obstruct the vessel. That seems to be the cause of it. Well, luteolin, a benign plant extract chemical, actually has been shown to prevent that. And so I'm writing a newsletter for next month that's going to talk about it, exact mechanism how it does that. But we've noticed that luteolin also prevents brain fog. People talk about they have brain fog, and they fed them luteolin, or provided, and it cleared up the brain fog. Well, that's because of microglial activation. And the luteolin prevents microglial activation. It returns it back to a healthy type of microglia.
How do people get this? Is this something in food?
Well, it is in food, and celery is fairly high, but you can get a supplement, usually from something like Amazon.com. You can buy it. It's purified. It's pharmaceutical grade. I recommend people take luteolin 3 times a day just to protect their vessels. And we look at the animal models that have a high incidence of atherosclerosis, and they're fed luteolin, and they have no atherosclerosis, or very low atherosclerosis. So it is a very powerful way to prevent hardening of the arteries, far better than and far safer than statin drugs. Statin drugs are, to me, a scam, and they're dangerous. They're very dangerous.
These different nutrients that we've talked about, is it advisable that someone take all of these? I mean, how would you approach a kind of daily regimen of doing these things to protect the brain? Is certain people better to take some than others, or what? How does someone build a regimen for this?
A lot of it depends on your age. For instance, if you've eaten a Western diet most of your life, you have a lot of damage to your blood vessels, to your organs, to your brain, and so it may take a combination of these things. If you're young and you're starting out and you're going to start eating organic food and avoiding the seed oils, things like corn oil, peanut oil, safflower oil, fried foods. If you're going to do that early in life and protect yourself, then you may get away with just something like curcumin. Just take that 3 times a day, the nano curcumin, and it'll keep your arteries clean, and it'll keep your microglia quiet, and it'll convert them to a healthy microglia. And the other immune cells will be quiet in your body and more efficient at getting rid of bacteria, and it'll prevent free radical generation, which damages all the organs with the disease. If you look at disease of everything from the heart to kidneys, the liver, the intestines, it's all free radical generation produces most of the damage. And one of the things I tell people, and I put in my newsletter, was about nitric oxide. I said, all this craziness about nitric oxide being so healthy, it's very damaging. It's part of the excitotoxic reaction. And most of the supplements that protect against excitotoxicity and damage to the brain lower nitric oxide. Things that help the heart lower nitric oxide. So this stuff of taking supplements to raise your nitric oxide is very dangerous and very damaging in my opinion.
What kind of dosage should people be looking at if they're going to take curcumin 3 times a day? How the nanocurcumin you said specifically, how much should they be taking, would you say?
Well, if you're an adult, I would take 500 milligrams 3 times a day. You find it's very safe. 99% of the people have no side effects. Others might have a little gastric upset, but just take it just before a meal. And if you are taking nanocurcumin, you usually don't even know it, doesn't bother you. It's found safe and much larger dose. Like I said, they gave over 8,000 milligrams of curcumin without any safety concerns and no damage to anything. So this is a far smaller dose, but it's enough to protect the brain and the other organs and the blood vessels and the heart, intestines, and prevent colon cancer.
You gave this as kind of the case of someone who's younger, who's started to cut out these different omega-6 oils and different foods, processed food that can be a risk to the brain and be a risk to heart health and things. What about in the case of someone, an older person who's been, as you said, eating the Western diet for many decades and have kind of taken on a lot of injury to their body? What kind of regimen would you suggest for someone in that situation?
Well, then I would add more. I would at least add the curcumin, the white tea, maybe the EGCG, particularly the luteolin and apigenin. Then your regular vitamins like vitamin C, I would take a higher dose, for instance, 2,000 milligrams a day or 2,000 milligrams several times a day. And occasional vitamin E, as I discuss in the paper, there's different kinds of vitamin E. There's about 8 different forms of vitamin E. And there's a form called the tocopherols. They're far more anti-inflammatory and protective than the tocopherols, which you get at most of the things like Walmart. You'll go buy DL alpha tocopherol, which has no effect and may increase cancer. But the alpha tocopherol is more helpful, and the alpha tocopherol is even more powerful, and the gamma form of tocopherol is the only inflammatory form. So you have to know the forms to use and take, and the tocopherols are very brain protective and protect the other organs as well, but it's tremendously brain protective.
What kind of dosage would you suggest for taking those?
Tocopherols, it usually comes in a 50 milligram caplet, and I recommend 3 a day, 1 with each meal. And the luteolin, there's not a nano form, but it's pretty well absorbed. As soon as the manufacturer can find some not made in China, he's going to make a nano luteolin, so it's better absorbed. But even using the form that's not nano, it seems to prevent these atherosclerotic changes in the blood vessels. And its mechanism is very well worked out. It's quite safe. It reduces brain fog, which is a big problem with several vaccines and head injuries and particularly the COVID things. And it's due to microglial activation in the brain. And luteolin really converts that microglial activation to a normal microglia. So I would take that about 3 times a day. I think it comes in something like 100 milligrams 3 times a day.
What about for children? What would you recommend parents give their children to give them the best start in life to preserve their brain health?
Well, they should eat organic food. Avoid the Western diet. Don't eat too much sugar. Be very careful with sugar. It can be toxic. Don't use high fructose corn syrup. Avoid the seed oils, things like corn oil, peanut oil, safflower, sunflower oil, canola oil. If you use cooking, use the coconut oil. Extra virgin olive oil is good for you, but don't cook in it. But you can take extra virgin olive oil, a couple of teaspoons a day, and protect the child by having a good diet with lots of fruits and vegetables, mainly vegetables. Fruits have too much sugar in it, but the vegetables, get them used to that, and they'll be far healthier.
We'll hear more from Dr. Blaylock shortly, but first off, in response to viewers' requests, here is his post-interview advice on which type and how much magnesium to take to support brain health and counter excitotoxicity. He suggests adults take 250 milligrams of magnesium citrate 3 times a day, taking the last dose just before sleep. He suggests combining each dose with 50 milligrams of riboflavin 5-phosphate, which also works against excitotoxicity. Dr. Blaylock adds that if diarrhea occurs, it signals that magnesium is being poorly absorbed or the dose is too high, in which case one may reduce the dose or try taking a slow-release form of the supplement. Of course, it's best to speak to your own doctor or other health practitioner about what's right for you. The body will generally discharge any excess magnesium. However, this may not be the case for someone with impaired kidney function. Ingesting too much magnesium can bring on short-lived symptoms of being poisoned, including nausea, myasthenia, abnormal breathing, hypersomnia, and urinary retention. As for riboflavin 5-phosphate, it's advised to immediately contact your doctor if you have severe eye pain or a sudden change in your vision. This supplement may increase your light sensitivity, in which case you may want to limit bright light exposure or wear sunglasses to lower discomfort. I hope you're enjoying this Vital Signs episode. In a moment, we'll get Dr. Blaylock's take on the kinds of drug treatments that exist for Alzheimer's disease. But first, here's a look at what a berry of distinction, the elderberry, can do for your health. If the pandemic taught us anything, it was the value of having a robust immune system. And elderberries and elderflower just happen to be a premium source of powerful antioxidant. It wouldn't surprise me if traces of elderberry showed up in Tutankhamun's tomb. Elderberry's real power lies in its bioactive compounds. The quercetin, anthocyanin, not to mention vitamin C and other antioxidants in elderberries all suggest a strong antiviral effect. Let's look at the airplane experiment. Those in the placebo group suffered significantly longer colds and more severe symptoms than those in the elderberry group. Modern research continues to uncover the potential of elderberry to boost immunity, fight infections, and promote overall health. So could elderberry have really played healing roles in these different cases? We're going to find out what the research and everyday stories of health recovery reveal about elderberry's potency. Afterward, find the link to that video at the top of the comments and also in this video's description below. And to subscribe for full access to our ever-expanding insights on fine-tuning your health, just hit the big red button below. Thank you very much for outlining that, Dr. Blaylock. On a slightly different note, I'm aware that there are these drugs that are available for treating Alzheimer's. There are ones that target this buildup of amyloid plaque in the brain. There's other drugs that seek to increase the acetylcholine, which is a neurotransmitter involved in learning and memory. How do these drugs compare to the natural, the nutrient approach, would you say?
Well, the drugs, which kind of changed the pathology of it, have been ultimate failures. They were real excited about one that would increase acetylcholine production, and it didn't work. And they've tried several of them, and they just don't work very well. What we find is that it's an excitotoxic, what I had labeled an immunoexcitotoxic disorder, and it's found that DHA removes almost all the amyloid from brains. They tried on experimental animals and others, and they found that it does reduce the amyloid significantly. Well, EGCG also reduces it. Curcumin reduces it. And curcumin has numerous effects that fight Alzheimer's. One, it increases mitochondrial function. It reduces the amyloid, reduces the hyperphosphorylated tau, and it reduces all the inflammatory chemicals that trigger it. So it's a natural product that has so many mechanisms that it's affecting. It's just a very long list, where drugs only attack one thing. And the drugs have been a failure, because if you attack one thing, then the other things increase in activity. So that's why they fail. But it's been a dismal failure using the drugs. And they're very expensive, lots of side effects. So most of these natural substances, they have no side effect or very minor side effects, just gastrointestinal upset or something.
Yeah, I was going to ask that as well, if there are any of the things we've talked about, the curcumin, the quercetin, these different things, if any of them, or if there are any side effects that people should be aware of or be alerted to.
Well, the thing about quercetin, and a little bit with curcumin, is it produces hypoglycemia, which is good for diabetics and people with insulin resistance and metabolic syndrome. What I tell people is just take it just before you eat. And if you take it before you eat, it doesn't do any of that. You're fine. We have an explosion of type 2 diabetes, insulin resistance, prediabetes, metabolic syndrome. There's 45 million people with metabolic syndrome. And all these flavonoids assist that tremendously. It reverses insulin resistance, makes your pancreas secrete more insulin to aid in these type of diseases, diabetic diseases. And so it's the perfect example to a lot of these things.
Is there any side effects to worry about? No.
No, I wouldn't worry. Now, some of them also make slightly thin the blood. And there's always a warning, well, don't take them if you're taking blood thinners. And I used to tell fellow physicians, I said, well, if you're warning that it's a blood thinner, why don't you use it as a blood thinner? For instance, like ginkgo biloba is like taking an aspirin a day. And so they were warning people not to take ginkgo biloba. And I said, well, ginkgo biloba significantly helps the brain. And you want an anticoagulant, why don't you use it? It's a lot safer than what you're using as a drug. Some of these other things are just very minor. They're like half an aspirin at the most. But I don't really worry about the anticoagulant effect. And usually the effect that we're seeing is it's anticoagulant drugs. They can be dangerous.
Where would you recommend people go to find this kind of information?
Well, you could read that article I wrote on natural treatment for neurodegenerative diseases that you read. And of course, the literature is filled with it. You could just look up the name of a supplement and look through the scientific literature, and you'll find out it's extensively tested, extensively researched. We know how they work, a lot more than we know about common drugs.
And now, just a further note on EGCG supplements. While safe for most people, they have been linked with liver and kidney failure, dizziness, low blood sugar, and anemia. Additionally, they are not recommended during pregnancy or for women who are breastfeeding. Thank you for outlining the side effects for those, Dr. Blaylock. I think this is a very, very good overview of different nutrients that can, in place of medications, have a significant effect in preserving brain health and potentially staving off Alzheimer's disease. Thank you very much for coming on and enlightening us about these things.
Yeah, I think what the advantage we're seeing is that each of these supplements attack all of the major pathological changes occurring with disease. Free radical generation, inflammation, they're anti-carcinogenic, they inhibit some of the major viruses. In fact, they're better at inhibiting viruses than a lot of the medications given. And these things are unknown to physicians. They don't know about because they don't read it. They don't study this literature.
We've just learned about a broad regimen of plant products and extracts which can cut inflammation, toxicity, and lower the risk of Alzheimer's disease, like the DHA found especially high in small fish, like sardines, the EGCG in green tea that can cut metal toxicity, and the quercetin and curcumin best taken in nano form to optimize their anti-inflammatory impact. Speaking of quercetin, to learn about a prime dietary source of this antioxidant, anti-inflammatory, and antiviral powerhouse nutrient, find the link to my video on elderberry at the top of the comments and also in this video's description below. Also there you'll find the link to Dr. Blaylock's The Blaylock Wellness Report, with science-backed natural approaches for raising health and living longer. With that said, it's been great to be with you. I'm Brendon Fallon, and this is Vital Signs.